Hello everyone, this is Dr. Prashanth and welcome back to my public health series. In this video, I'll be briefly talking about school health program. It is an initiative designed to promote the health and well-being of school children, incorporating healthcare services, health education, and the development of healthy behaviors. It plays a crucial role in addressing health challenges among children, including malnutrition, poor hygiene, and lack of access to healthcare. And now coming to the objectives of the program, to provide information about health and nutrition to the children in schools, to promote healthy behaviors among the children, to detect and treat diseases early in children and adolescents, including identification of malnourished and anemic children with appropriate referrals to PHCs and hospitals, to promote use of safe drinking water in schools, to promote safe menstrual hygiene practices by girls, to promote yoga and meditation, that is through health and wellness ambassadors, and to encourage research on health, wellness and nutrition for children. And the target population for this program is all government and government aided schools in the country. And now coming to the services provided, under the first category, that is the school health promotion activities, we can see age appropriate incremental learning for promotion of healthy behavior and prevention of various diseases. So it is delivered through teachers or health and wellness ambassadors who are trained in each school. And next is health screening. Under health screening, you can see screening of children for 30 identified health conditions for early detection, free treatment and management. And under provision of services, you can see provision of IFA and albendazole tablets by teachers through weekly iron folic supplementation and National Deworming Day program respectively. And also provision of sanitary napkins and age appropriate vaccination. And next is the electronic health records, that is to maintain electronic health record for each child. And the last is the imparting skills of emergency care, that is through training of teachers on basic first aid. So now let's start with the first category, that is the health and wellness ambassadors. 2 teachers, ideally 1 male and 1 female, in every school will be designated as health and wellness ambassadors. So whom do they select? Those teachers who are proactive and self-motivated will be selected as the health and wellness ambassadors. So the age limit is less than 45 years and preference is given for those teachers who are from science and physical education background. So these teachers will be trained to translate health promotion and disease prevention information in the form of interesting activities. Okay, that is for 1 hour every week. And students will act as health and wellness messengers in the society. So they help in improving health practices in the country. So every Tuesday may be dedicated as Health and Wellness Day in all the schools. So now coming to the training part of the program, we can see stepwise training approach. So in the step 1, we can see national level training where the trainers from Ministries of Health and Education will conduct training for national level master trainers. So these master trainers will then train the state level trainers. And in step 2, we can see these state level trainers will train the district level trainers. And in step 3, the district level trainers will train the block level trainers. And in the last step, that is block level training, these block level trainers will train 2 teachers per school. We call them as health and wellness ambassadors. And also the block level trainers will also conduct a 2-day orientation for all school principals in their respective blocks. So for better understanding, I have given a flowchart for this. Starting from national level master trainers, these national level trainers will train 4 state level trainers. So state level trainers will train again 3 district trainers, and district trainers will train again 3 block level trainers. And these block level trainers will train again 2 teachers per school. We call them as health and wellness ambassadors. So teachers will eventually educate the students. And now coming to the activities in school, first under the weekly activities, we can see classroom transactions by health and wellness ambassadors. Second, administration of IFA tablets. So these 2 activities are done weekly. Under monthly activities, we can see thematic school assembly and question box responses from the children. And under quarterly activities, we can see parent-teacher meetings and also thematic adolescent health days. And under biannual activities, we can see administration of albendazole tablet, that is under the National Deworming Day. Okay. So next is the school health promotion activities. So under school health promotion activities, we can see 3 categories: primary school, middle school and high school. So we can call this as the age appropriate health promotion. So depending on the child age and the class he belongs to, the activities will be focused. For example, Under the primary school, you can see the health, growth and development related activities, personal safety, nutrition and physical activity, hygiene practices, and also prevention of diseases like malaria, dengue, TB, worms infection, etc. And in the middle school category, you can see the puberty and puberty related changes, eye care, oral hygiene, nutrition, meditation and yoga, internet safety and media literacy, HIV or AIDS, mental health activities, etc. Under the high school, you can see the prevention of substance abuse, sexual and reproductive health, violence prevention, unintentional injury, road safety, nutrition, meditation and yoga. And now coming to the next one, that is health screening, that is under the Rashtriya Bal Swasthya Karyakram or RBS scheme, which I have already discussed in my other video, that is under National Health Programs. But still I will go through it very briefly. The objective of RBSK program is the early identification and intervention for children to address the 4Ds. They are defects at birth, deficiencies, diseases, development delays, including disability. So for age group of 0 to 6 years, that those children are managed at District Early Intervention Center, that is DEIC. For those children in the age group of 6 to 18, they are managed through existing public health facilities. So what is the role of DEIC? It serves as a referral linkage for both age groups and also ensures necessary treatment or intervention is provided after screening. And under screening and referral, as already discussed, children are screened usually at schools and they are referred to appropriate health facilities. So that is based on the age group. Okay. So if it is 0 to 6, they are managed at DEIC. If they are 6 to 18, then they are managed at the existing public health facilities. And the treatment is delivered at zero cost to families. Next is provision of services. As already discussed, first is the weekly iron folic acid supplementation. So for the age group of 6 to 10 years, the dosage is tablets of 45 milligram elemental iron and 400 microgram of folic acid. For the age group of 10 to 19 years, the dosage is tablets of 100 milligram elemental iron and 500 microgram of folic acid. For both the age groups, it is given weekly, and the service delivery is through teachers in both age groups. And now coming to the other activities, first is the deworming or the National Deworming Day. So under this, we can see albendazole 400 milligram tablets are provided to children in government, aided and private school in all the three categories of the schools. So the dates for deworming are 10th August and 10th February. And now under menstrual hygiene, you can see sanitary napkins are provided for adolescent girls. And under health screening, we have already discussed it, RBSK. Identification of 30 diseases including malnutrition, anemia and refractive errors. And children with refractive errors are provided spectacles. And also appropriate referrals made for further treatment of the screened children. And coming to the physical and mental fitness, under physical and mental fitness, you can see yoga and meditation classes and also promotes healthy habits inspired by International Yoga Day. So that is on June 21st. And coming to the last one, that is research, studies and research on health, wellness and nutrition to measure the program's impact. So now coming to the last one, that is the health conditions identified for screening. As I already mentioned, there are 30 diseases, right? So we can classify them into 4 categories. First is the defects at birth. So under defects at birth, you can see neural tube defects, Down syndrome, cleft lip, congenital heart disease, all these things. Under deficiencies, we can see vitamin deficiencies like vitamin A, vitamin D, and also severe acute malnutrition. Under childhood diseases, first is skin conditions, for example, any fungal infection, eczema, all these things. Also rheumatic heart disease, dental caries, convulsive disorders, all these things come under the childhood diseases. And now coming to the last category, that is developmental delays and disabilities. So under that we can see vision impairment, hearing impairment, motor delay, cognitive delay, language delay, and also autism, learning disorders. All these things come under the developmental delays and disabilities. And now coming to the last disease, that is congenital hypothyroidism, sickle cell anemia, and there is one optional disease, that is beta thalassemia. And thank you.